Okay, awesome. So, hi everyone. I'm Shalin Butterworth. I have a special guest here today at the Nest, and this is Dr. Heather Hunt. And we're going to share some information for you on chiropractic care and other services she can offer, and why that might be beneficial during pregnancy and as we prepare for birth. So, Dr. Hunt, thank you for joining us. Would you mind sharing a little more about your practice and what you offer?
Sure. I am a chiropractor and I do craniosacral therapy and I practice functional medicine here in Nevada City. I actually grew up in this area and my dad's a chiropractor. And so I've been raised with chiropractic and I kind of come from why wouldn't you need chiropractic? So because I've had it my whole life and
Yeah.
honestly don't really know how people survive without it. Um, I have been in practice for 14 and a half years, and I got pregnant with my first baby when I was in my last year of chiropractic college. And being raised in chiropractic paradigm, chiropractic is really based on trusting your body and knowing that it has this innate intelligence in order to live in this world and maintain homeostasis. And so having that strong, and my mom, I'm the oldest of four. I watched her, I was there at her, her three births that came after me. And
You were
so
there at them?
I was,
Oh,
yeah,
wow.
she had home births. And so, and the third and fourth, I was 10 and 12. So
Okay.
it was quite significant.
Oh,
So
yeah.
I knew I could be pregnant and have a baby, and that was a natural process. And I didn't doubt that about myself until I got pregnant and I went down to Powell's Bookshop, which is one of the largest bookstores in the whole country. And they had a huge section on pregnancy. And I was trying to find some resources. And everything was so fear-based that I started doubting myself. And I thought, oh my gosh, if I, being raised how I've been raised and trusting my body like I have been taught my entire life, could doubt my body in this process, there is something really wrong here. So that really politicized me, actually. And at that moment, I really felt like I am going to dedicate, myself to figuring this out and to really helping women have, and families, keep that trust. And if you don't have the trust in the first place, is to learn about your body and really trust that your body knows how to do this. And we need help sometimes, and that's great. Often we need help. And so that's where chiropractic comes in. One of my favorite parts about chiropractic is that I can have a woman come in that has been told by everybody else in her life, oh, you're just pregnant. Like, don't worry, you're just going to be uncomfortable and you'll be better after you have your baby.
Yeah.
And even when I have people come in their third trimester and they're really uncomfortable and it's very severe and I help them get better, it's just a really neat way for you to learn more about your body and realize that, I tell them when I help them get better in their third trimester or anytime in their pregnancy, I say, please remember this, because as you get older, you will also hear, oh, your body just falls apart. Like, of course you have that pain. You're getting older. It's like, no, never accept that. Never accept, your body is magical and it has a lot of capacity for healing at any age and wholeness and freedom from pain. And so with chiropractic, reasons why somebody might seek a chiropractor with pregnancy is any pain or discomfort, which of course you're going to have, which is why I think, how can people survive without it? But I'm trained in something called the Webster technique, which is specific for chiropractic. Specific for pregnancy. It also is known to help turn breech baby, which is not true. It actually helps get the pelvis into alignment so babies can achieve the natural optimal position for birth, which is head down.
I love the way you said that, because we talk about this in our childbirth class, and I talk about it with my pregnant folks all the time. Is babies are really smart. They're wise. They know what they need to do. They're trying to get, head down in the best possible position for us, the pregnant person, and them. But if there's misalignment, it makes it really hard for them to do their job. So I just wanted to highlight, I totally agree.
Yeah. And also, when I say everybody needs chiropractic, there's a caveat with that, in that all of medicine is very much focused on men's bodies. On, it is. We live in a patriarchal society. Medicine is realizing that chiropractic is still largely based in a chiropractic adjustment, which is when, you adjust something and it pops. Oftentimes in women's bodies, but very much, especially in pregnant women's bodies, we don't necessarily need to be adjusted a lot. A lot of times we're dealing with what I call globalized hypermobility, which is just when all of our joint, and especially with pregnancy, right? All of the joints get loose because of relaxin. And again, that's part of the natural process. And if everything was imbalanced, that wouldn't be a problem. But if somebody, you're out of balance, if you have pain, like on a particular side, say, like, oh, it's always on my left, or it goes between, because then, there's an imbalance, right? Mm-hmm. And so what I really try to do is, so I'm trained in the Webster, I'm trained in what my dad trained me since I was little, which actually is quite conservative with chiropractic adjusting, being really specific with where you adjust, because I don't want people to just like run out necessarily and just find anybody. Like, make sure if you go to a chiropractor, they're really trained in women's health and women's bodies. After my 3 sons get older, that's part of my mission, is to go back into some chiropractic schools and things and start training them and what I've learned, because it still is largely focused on the male body. But just to be really clear on not getting overly adjusted is important. And doing a lot of more soft tissue and ligament releases. And then I do adjust, and I love that. And it's so effective. But you just need to be a little careful. I
love that you brought that up too, because I do think so many people, I find, when you say chiropractic care, they're like, oh, someone's going to go and like crack me and crack my bones. And I don't really see how that would be super beneficial. But right. I know, especially myself, unfortunately, I didn't get to be with you during my pregnancy. I wasn't in the know and in the area at that time, but I know getting chiropractic care made me feel so much more comfortable. And as a mom who was pregnant over 35 or advanced maternal age, a lot of people said, oh, you're just going to be more uncomfortable. That's just right. Kind of the way it is. But you're exactly right. As I would go and see my chiropractor, and it would be an adjustment, but she would really focus on the ligaments, and she would focus on my growing belly and how that was changing the way I carried my body, and also those aches on my right side, and why is that there, and addressing that specifically. So I just wanted to again highlight that, because I do think that's really helpful for people to know it isn't just about cracking and that type of manipulation.
Right. And it is really, again, when you're with somebody trained and paying attention, it is very safe. And I even adjust babies. And I've worked with people at the very end of their life, at the beginning. And that's also why I love the cranial sacral therapy, because it gives me an in for systems that don't need adjustments, that have restrictions in subtler areas, or like for babies have in utero position issues, or they're not turning their heads right, or they're always, most babies come out with a little C curve, and, and so I can really start with more gentle techniques like cranial sacral. And then if they need it, we move to chiropractic if the parents feel comfortable, and I explain, this might be a little uncomfortable, your baby will probably cry, just for a few minutes. But I just had one yesterday, actually. A baby came in at 1 month, referred in by another mom, couldn't turn her head right really at all, really hard birth, very traumatic birth. And the mom was prepped. This was great, because one of my longtime patients referred her in, gave her the whole rundown. So I hardly had to do any education. And so she came in, and I did the cranial, and I said, I really think it's rare, very rare, but I said, I think this baby needs a neck adjustment. And so I explained it, and she said, great, do it. We did it. The baby hardly cried. It was not a big deal. But then they came back yesterday, and she said that day when we left the office, the baby was like, both sides, which completely changed tummy time, which completely changed nursing.
I was going to say breastfeeding, nursing, I'm sure was affected.
Big time. So, there's so many tools. I feel so fortunate, because I'm a compulsive learner. Like, you should see my nightstand and my tabs on my computer. Like, I'm studying all the time. So So I'm always adding new things in. And that's also why I added in the functional medicine, is because when I was postpartum with my babies, chiropractic wasn't going to do it for me. Like I needed massive adrenal support. And so I've also made that a, we have very low cost blood panels. I catch a ton of postpartum thyroids, hypothyroid situations. I do a lot of education around blood sugar stability and have resources on that on my website, and adrenal health. And like you, I'm really wanting to build my resource library, and good for you for making these videos. It's really important.
I think so too. It's all a part of, when we get pregnant, you don't know what you don't know. And I always remind people, if you don't know your options, you don't have any options. So just discovering more about how can I make my journey more comfortable? How can I prepare for the easiest possible birth for myself and my baby? And just everything you kind of already segued into my next question. And I actually have a few more that I want to make sure we cover. But one is, so if someone comes to you, when do you normally like to see them in pregnancy? And what are all of the options on the table as far as things they can receive from you with your services?
So, I find that given left to their own devices, moms usually come about 25 weeks, which is great. I love starting earlier, obviously, especially if I can catch something, I honestly, with my first pregnancy, had more low back pain than in the first trimester than any other time in my pregnancy, which totally freaked me out. Because I was like, if I have this now, what am I looking at, right? And so when I get women in that first trimester, I really explain, like, don't worry, this is mostly hormonal. Well, you are not going to feel like this the rest of your pregnancy.
Right.
And so I feel like a part of what you'll get from me absolutely is 100% support. Like I really try to be very available for my patients. I have a busy life. I run a practice. I have 3 sons, but I often will give out my cell phone number or my email, or, just like, call me if you need something, text me, let me know how this went, because it's really important. And pregnancy, you are in a vulnerable time. And for me, it was the first time my body wasn't predictable. And it was, going through different hormonal shifts and having different aches and pains. It was hard for me to not think like, oh no, is this going to be the rest of my, like, oh, I can only eat white foods. Is my baby getting enough nourishment? Things like that. Like,
yeah,
but it's fairly constant. And since I do pay attention to so many different facets of this, I feel like I can offer help in a lot of ways for women, even beyond just the musculoskeletal. So in that way, I love to see people soon, because it's like, are you on your fish oils? Do you have, are you, yes, okay, you're eating this way, but can we figure out how to tweak it a little bit to get you a little more protein? Or, I do a lot actually.
Yeah.
And then
it sounds very individualized. Like you really are looking at the whole person.
It is. And it's also quite intuitive. Like yesterday, I had a new patient that was pregnant, and I just started talking to her about the importance of eating regularly, because it felt important for some reason that I didn't know. And as soon as I started, I kind of gave her my blood sugars, adrenal spiel. And she was said, oh yeah, I don't eat. I forget to eat all the time. Like, I just don't eat. And I was like, oh, this is why this is coming up. Like, we need to talk about this, because your adrenal gland, third pregnancy, your adrenal glands, your stress response system. If you don't do this, like, you're not setting yourself up for success here. And I have cheats, because I've been there, done that 3 times. And let me tell you my cheats,
Yeah.
So in that sense, I love to get people as early as possible, but anytime. Yesterday, I also had a new patient that's 37 weeks, her baby's breech. Great, bring it on. Like, no matter what care we get, it's just important, because I do really think that getting the pelvis into alignment, when it's off, it creates an android pelvis, which is a male pelvis, and it's a narrower opening. And even though I have full faith in the human body, like, yes, we need help, and sometimes we get out of balance, oftentimes.
Well, and especially, I don't think our lives look these days the way they did 100 years ago, right, or, longer. We're doing very different things with our body a majority of the day, one of which I'm doing right now, which is sitting in a chair.
Right.
that we
Right.
might spend a lot of time doing or moving in ways, or we've created these habits over time of misalignment, and then you throw a growing belly on there and relaxing, and it's now exacerbating whatever that issue might be.
Exactly. Exactly.
So, and we don't have to go
Oh.
into how you might address all of these, but I'm just curious if you have an idea, I'm sure you do, of, excuse me, the most common concerns that people come to you with in pregnancy, just so people have an idea of, oh, I didn't know she could help with that.
Totally. So most people come in and have pain in what's called the sacroiliac joint. So that's, in the upper sacrum. Some people say I have sciatica. I'm like, no, it's not sciatica. It's your sacroiliac. Gosh, I'm going to grab my spine so I can show you.
Yeah.
Um,
I'm familiar with this because this is what I had with my second pregnancy.
Yeah. So if this is looking from behind, right? Here's the sacrum. These are the ilium, and then your low back. The sacroiliac joint is right here. And these ligaments, these blue things are ligaments. Ligaments connect bone to bone. And with pregnancy, there's this relaxin, and they get stretched. So when something gets too stretched out, then all the muscles contract around it to try to protect you, because the body's super smart and it doesn't want anything to be like too mobile, right? That creates degenerative wear patterns. And so the muscles all spasm around. Oh, there's my camera moving. So then the muscle spasm, and that causes pain. Also, when you have that kind of pain, it means that the pelvis is rotated already, right? And so, I do a bunch of ligament release. I actually have a really great video called Low Back Exercises on both the Heather Hunt DC and the Hunt Vitality website.
Okay, and we'll attach your website information.
Yeah,
with the video.
it's 17 minutes, and it actually has exercises and everything for it.
Okay.
The other thing I get a lot of is what people think is right shoulder blade pain, but it's really gallbladder congestion.
Whoa, okay, I gotta hear more about this.
So they'll come in, let's see if you can see. So it'd be like pain, right? Can you see that?
Yeah.
Pain right there, and it can wrap around the other places right here,
Okay.
right? Under the rib cage on the right. And they'll be like, oh, I can't get out of this pain. Like, it's just constantly achy, sometimes sharp. And so then what I say is, oh, you can't get out of it, because musculoskeletal pain, you should be able to get out of it. Like, you should be able to rest at night and have it feel better, or lay in a certain position. And this is really important, actually. Organ pain, you can't get out of if it's organ based or gland based, So, liver gallbladder can get backed up with pregnancy, which we know with all the liver issues, but gallbladder is less known. But having all the extra estrogen thickens the bile. And so it slows down the gallbladder. And we can, some people, one of my girlfriends in chiropractic college had to just not eat any fat when she was pregnant, because gallbladder deals with fat, digestion, and her gallbladder couldn't take it. And so we have some really great, like, natural food-based supplements that I give women for that. And it's like the pain goes away.
Wow.
So, and it's really cool, because in mainstream medicine, they really don't know what to do with it. I mean, except tell you, like, don't eat fat, but that's not a good idea if you're pregnant, And so I have blog articles on that too, but there's just pieces of information, mastitis, like poke root for mastitis, like, that is just so vital that people know. And unfortunately, in mainstream medicine, that's just not really covered until it gets to a disease process. And we're trying to catch it. And before it gets to that, when it's just an out of balance. So those are some things that I deal with quite frequently.
Yeah, you touched on like two very different areas of addressing. I mean, that's amazing. And so I feel like, there's just so much you can offer people with regards to, it's not just the bony structure, but also everything that's connecting it, and even the organs and what's going on underneath. So, so if someone were to come to you, what does the typical schedule of care look like? How often do they see you?
So it's $150 for a new patient appointment. That's a 45-minute appointment. With chiropractic and pregnancy, I generally recommend doing a 3-time trial. So I do 1 a week for 3 weeks, which includes the first visit. Okay. Follow-up appointments are 15 minutes. They're $60. We don't take insurance, but we can give you a super bill.
Mm.
And you can bill your own. And then usually by the third treatment, moms are feeling a ton better. And at that point, I create a treatment schedule for them, because I don't want to just, it really actually bothers me when someone goes to a chiropractor and on the first visit, they get the treatment schedule, because that doesn't take into account how they are responding and adapting to the care and how fast their body is taking that care in. So to me, that's a red flag when you go somewhere and they're like, oh, I've got to see you 2 times a week for 6 weeks or whatever. Don't do it.
Oh, yeah.
Especially as a woman's body, that is too much. That is too much. And you need to have somebody that is paying attention to your progress and how you're taking the treatments in, so you don't get overtreated. And so usually by the third treatment, women are feeling a ton better. In the Webster training, they say you see a chiropractor as much as you see your primary care provider. So often it's once a month. If somebody comes in with a more acute issue, or they have like an old low back issue or something like that, that they're just, it's harder for them to, it's just harder for them to stay out of pain. We might see them twice a month, once in a great while. Usually when people come in weekly, they put themselves on that treatment schedule because they want to,
because it feels
they
good.
feel better.
Yeah.
Which is fabulous. I love it. And I love having that time with them and having that commitment. But I often will do the 3, and then it's like every 2 weeks, once in a while at the end of the pregnancy, we'll need once a week. But it is sort of reflected in what you're seeing your OB or your midwife.
Okay. And then I imagine it's beneficial to see them during pregnancy, because then if they come in postpartum, which I'm sure you probably hope they do, you already know their body, you're familiar with all of their, concerns.
And because I'm a dork and I'm such a studier, right? And I also really do use my intuition. I call it tracking. I track my patients on multiple levels. So I not only track the musculoskeletal, but I track their relationships. I track how their kids are doing. I ask questions about all this because this matters in our bodies. I track how they're eating. I track what their employment status is. I track who their support system is. I always ask, who are your healing team? Who do you have on your healing team? Do you have a healing environment? It's like, and if they kind of look at me blankly, then I pay more attention. Right. And so, and then I track like the reason my practice is called Hunt Vitality is I track vitality in your body, and I know what vitality is. And so the more I get to know my patient's body, the more I get to know what their particular level of vitality is and where I want it. And then I watch it fluctuate, especially, through a pregnancy. And I love doing it postpartum, right? Because that gets tricky. That we put a lot of emphasis on pregnancy, but the postpartum for me was way more complex, and your body's still very unpredictable, but you're not sleeping as well. And so you might be sleeping but there's still other things going on. So that's, I think, why I've caught so many thyroids and things like postpartum thyroids, is that I've known the person's vitality in their pregnancy, and then somewhere along the postpartum, they lose it. And I can feel that in your body. And then it's like, can we run a blood panel? Like, okay, I can check your whole thyroid for $100. Can we just do it? I'll feel better. Or like, I need a ferritin. I need to check your iron. You just look pale. You've looked pale the last 3 visits. I'm not loving this. And in my blood lab, we can test ferritin for $20. Like it's so cool.
And such valuable information to have.
Yeah. And I really think it's important to have people in your life who are tracking you and who are doing it in a way that, my husband, for instance, is so great, and he tracks me in a certain way, but he also just wants me to be doing great all the time, so it's like a little bit less biased. Somebody who you can really honestly just say, I am not doing well. I am exhausted, or I'm having a hard time with this. And then we talk about it and we figure out, how can we support you? Does your physiology need help? Do you need to go get a massage? I prescribed somebody a week by themselves recently, jokingly, because I know she absolutely can't do it. But I was like, really, everything in your life would get better if you just had a week by yourself, like at a spa with people bringing you wholesome food, like really, right?
Yeah.
But it's important that I say these things. I say it in jest, but it's not. right? It's like your life is challenging right now and you don't get a break. And if you had a break, your body would know what to do with that. So I'm just planting the seed.
Yeah.
And maybe it's 2 hours or maybe whatever, but like these are all really important pieces of helping you maintain this homeostasis, this balance, which in pregnancy and postpartum becomes tricky. It really is. And it is also, I feel so impassioned about this maternity time because it is a moment that we have a lot of impact, not only for our own lives and our own trajectory and health and wellness, but in our child's. And in creating the whole family culture, because as mothers, we are the keystone of the family. Like we are what makes a family work. Unfortunately, it's a lot of pressure.
I know, but it is so true on so many levels. And I totally agree. You know, if mom's doing well, the family's going to be doing well. If mom's not doing well, the family could very much suffer, you know, in that way. So real quickly, when someone comes to you, when they've been seeing you through pregnancy and they come and they have their baby, what do you recommend as far as seeing you after birth? When?
That's another great question. So usually what I'll tell moms, because I love, especially once I like, you know, get to know my mommies, I love treating their babies at least once. I used to offer a free new baby visit until my midwife, after 5 years of doing that, was like, Heather, you have to stop doing that. That is like, you are not taking care of yourself and people aren't respecting you for that. So I did stop after that 5 years, but doing at least one treatment for baby is so important, you know, even if it's just cranial, because there is so much in uterine constriction, you know, when they're in the tummy, especially if they're like, I'll ask a mom, because I can tell by the baby's body, oh, were they just in the same position for the last, 6 weeks at least? And they're like, oh, for 3 months or whatever, they've been this way. And those babies need to be treated, anybody with hard births. But as far as like a particularly impactful moment, that is a really impactful moment for a human's life. So I do not like treating babies before about 3 weeks because it takes them about 2 weeks at least to land in a human body. My midwives called it a real birth around 2 weeks. And so you might think you have angel baby for the first 2 weeks, and then at 15 days, they turn into like colic baby, right? So I like to have, and sometimes when I treat babies before the 2 week mark, I'll miss things because they literally like aren't there yet. Like they're not manifested yet. And so I tell my moms, book an hour, 3 or 4 weeks past your due date. So, and in that hour, I see the baby for 45 minutes and the mom for 15.
Okay. Perfect.
So unless the baby has a tongue tie issue, a nursing issue, a really traumatic birth, unless there's like an emergency that we need to treat right away, like a nursing, they can't latch, then come sooner. But otherwise, about that 3 week mark is great for mom and baby. Okay. And then I assess with mom to see what is needed and if they want to continue with baby. But in my ideal world, everyone would come in once a month, because even once every 6 weeks, but once a month seems to be magic, even for a 15-minute. I do book up to hours, like if people want to do cranial, or have a longer appointment. My favorite time is 30 minutes. If I had to choose one, of course, I love hours with somebody, that's lovely, but it's more expensive. But I can get a lot done in 15 or 30 minutes. And even if someone could only afford the 30 or the 15 minutes, the $60 once a month, it's big. And it's big, especially because I will track you, and I really take a lot of responsibility with my patients. There's different healing models, right? And some are like, don't take on your patients, blah, blah. And I'm like, no, I take on my patients. I take responsibility for however I can be of help in their lives. I don't take it on in my physical body or my emotional field, that kind of thing. But it is like, when you come in, it is important to me that we are in responsibility to each other, and when people come into my healing field, I want them to be full participants in that and inform me how they're doing. And I love tracking. It bothers me when people fall off, and that's okay.
We care. I think I'm in a profession too, where we really do care. We're doing this work because we care about people and their lives and how they're doing.
Yeah.
So,
and if they fall off because they're going to other practitioners, or they decide they just want massages or whatever, I don't care. That's great, but I just want to make sure that somebody's looking out, looking out for you.
Yeah.
No.
So I think my last question for today, actually two things. One is I would love, you've thrown out different offerings and services that you provide. Could you just kind of list all of those different things that if people come to you, the different things that you can offer to them? And then after that, just anything else you think that would be helpful for us to know before we say goodbye just for today.
Yeah. So I've been in practice 14 years with my dad at Jacobson Chiropractic. I just took over the full business last year, which is exciting. Rebranded it as Hunt Vitality Chiropractic and Wellness Center. I've always wanted to be a resource center for women. Even when I was in college, I knew that. At that point, I was good at like writing college applications and getting grants. So I was like, maybe I'll have, so we have a new location on Zion Street, and I am very committed to vetting different professionals and having a team of services. So like when Katie reached out into the Nest, actually, I reached out to Katie when I knew I was buying this building, which used to be Mariposa Birth Center. Mm-hmm. So there's been more than 100 live births in my new office, which I love.
That's awesome.
I love. And before that, a bunch of women worked at a collection agency. And before that, a man raised 3 daughters. So that's the history of this. It's a great just feel of the building anyway. And then we completely remodeled it. And I have a really incredible Rolfer. I have Tim McNeely, and then my dad is here too, part-time, Dale Jacobson, and then an acupuncturist just joined us from San Francisco named Rebecca Fettig. She's been doing Japanese acupuncture for 18 years. She has a clinic still down in San Francisco, but she just moved up here. She's incredible. And then we have this classroom space, which the Nest is using, and I'm going to start populating more with like our own classes and resources. So those are all offerings. Mm-hmm. Personally, I offer the chiropractic and, soft tissue work, muscle release, massage, cranial.
And that's for pregnant and non-pregnant bodies, right?
Yep. Yeah. I mostly see women, but I do see men. A lot of my patients will be like, can I send my partner? Can I send my husband in? Can I? And do you see men? Is that okay? I've told him about you and he really wants to see you, because I'll say, well, go see my dog. And they're like, it's like, yes, I see men. I love seeing men. I have 3 sons. I feel highly impassioned about the plight of men and helping men in their bodies. So that's with chiropractic. I also have quite a few Medicare age patients, which I love, and a lot of kids and babies. I offer the cranial sacral therapy, which I love. I've been trained in the Upledger Institute as well as other teachers. That is a soft touch technique based on the osteopathic field that really works with the patient's own wisdom in their bodies and really helps release restrictions more in the cranial sacral system, which is more the like nervous system and the pumping of the cerebral spinal fluid. And so it's really great for stress and anxiety and intrauterine things, anything related to the nervous system and the head, concussions, headaches, down to the sacrum, though it's full body. Anyway, we could talk a whole hour about that. It's awesome. And then the functional medicine is blood panels. I have a 5-page metabolic intake form. It's an hour-long meeting to begin with, though if I already have a patient like I've been describing to you for pregnancy and I notice something, I'll often just be like, can we just do a blood panel on that? So it becomes a little more casual and more affordable than coming in. Shalin, one of the things I really want you to know about, I haven't launched it yet, but hopefully this fall, I want to do group appointments because the functional medicine is expensive. I mean, my blood panel, though it's a 10th the price of insurance, it's still $250. And then to see me, it adds up. And so one of my visions with that is to have like 4 or 5 women do like a postpartum group, a perimenopause group, because that's where I am now. It's really fun. and like a pregnancy group if they want, and then offer my hourly time very affordably, like $50 an hour or something. And then they just pay but they have to do the panel. And then we go through it as a group, and I want to do a thyroid group. Yeah. So, and then what I want to do is do it in the studio so that I can have my time with them and then leave them there and try to get women that I know will like resonate with each other so that they can build community, because so much of our health is based on how isolated or connected we feel,
Oh,
right?
yeah.
So that's something I'm really excited about launching. It's been a dream of mine, and now I actually have the space for it. Just to bring that down. And then what else? Those are the main things that
Okay.
I do
Yeah.
a lot of nutrition, and I have a lot of supplements that I love that have helped me attend, but it's sort of like whatever people want is how
Yeah.
we go.
Perfect. I love it. And we will share again your information and ways people can connect with you when we share this interview. And then I think just as we wrap up, is there anything we didn't cover today? I know there's a ton we didn't get into. We'll have to have more. A part 2 and a part 3 and a part 4, but just any parting words or advice or anything in particular you'd like to share before we wrap up.
Yeah, I think, pregnancy, being a woman, number one, is intense, right? We are a hormonal mishmash, and everyone who sees me is highly empathic, and I'm highly empathic. And that really changes the way we feel in the world as well, is when we're so sensitive and we really are feeling so many things from the outside world that aren't even ours, and having reactions to those. And I feel like we put a lot of pressure on ourselves. There's a lot of shoulds, and we have all these great things. Like when I had my first 2 babies, I didn't even have a smartphone. One is because they weren't invented, and the second one is because I refused to get one until the iPhone 5, because I knew I was going to get sucked into a world, which I have, and I love parts of it, and parts of it are hard, right?
Yep. Yeah.
And it does create a lot more shoulds, and we just should on ourselves too much. And I still do it, and I still struggle with how sensitive I am, how much I care about others and how they're doing and how the world's doing. And then you add pregnancy and having a baby, and my empathic responses went off the charts with that.
Yeah.
Like it became very much like I couldn't, even if I heard anything about like child abuse or something, it like shattered me after you have your own baby, And so I think just really taking good care of yourself, no matter how that looks, and really prioritizing that and trying to get rid of the shoulds as much as we can. And also, we're not perfect all the time, right? Like I am definitely not the mom I want to be every single day and every single moment. But we can apologize to our kids. We can tell them, why we have this reaction pattern, and say, I'm going to do better next time. And, there's just so many options when we just take a little bit of pressure off ourselves and let ourselves be highly sensitive, empathic humans that are doing our best in a world that, we're so privileged to be living where we're living, I'm a white woman living in California, like that incredible privilege, right? And it's still hard. And I still put a lot of pressure on myself, and I still have a lot of goals that I want to meet and things I want to do. And just to take more time, I think I'm talking to myself too, but just to take more time to take care of myself, to stay balanced, to keep investigating what does balance look like for me, and be okay saying no, even if I have serious fear of missing out, because our needs really shift around pregnancy and birth. And I think they shift for a lifetime.
Yeah.
We have a huge identity. What can become a crisis with motherhood, it can become beautiful and open you up into, I think motherhood is like, opens us up into so much magic. And also in that opening, I would say it's like the territory of my heart expanded so much that it took a while for me to populate it with just everything love-based and not fear and like anxiety too, right? Because it's all of a sudden we're blown open. And how do we really stay balanced, stay loving, keep the shoulds off us as much as possible, and ask for what we need.
Yep.
Clear about what we need.
And I think just to add on to that, it's so true that I think oftentimes we become a mom and we can generally speaking be such selfish selfless
Self-
beings.
yeah.
And we become so much like, I have this family, I want to take care of my family, I want to, do everything for them. And we sacrifice even sometimes more than we realize because of our selflessness. And that it's okay. And I sit with women a lot of time too and remind them it's also okay to take care of yourself. Like we need to take care of ourselves and do those things for ourselves and say yes to ourselves, say no to the other things and say yes to us. And it's so much easier said than done. Obviously, we know this because you're speaking and I'm going, yes, I need to hear this. And you're saying it to yourself. And, we need to remind ourselves and our community of mothers about the same thing. Like if you aren't taking care of yourself, you aren't going to be good for your family. And so this is just, the things you offer are just, some really important ways that they can take care of themselves so they can feel better in their body and their brain throughout this journey. But, and just to go broader with it, is there, anything and everything, taking that nap, going for that walk all by yourself, or, spending an extra 10 minutes in Target, mindlessly wandering around, or wherever you're shopping, just being in your own space by yourself is so helpful. But definitely improving that connection with our body and our mind through, body work can be another benefit. So I just love what you said. And it's such a great reminder. And, I think it can be applied to all of us, no matter what stage we are at in our parenthood journey. And so I think that's it. We'll wrap up.
Thank you so much.
Yeah, this is just feels like a springboard to a lot more conversations that we could have. So I super appreciate your time. Again, I'll share your information so people can get in touch with you. Also, if they come to any of our classes now, we get to be in your beautiful space. I just taught a class there. It felt so good to be there. The energy was amazing. There were so many smiling faces throughout our time together that night. And so I'm looking forward to seeing you and your space again next week. And we'll be in touch to do another one of these because this was great. And I really appreciate your time and energy. Thank you.
Thank you, Shalin. You too. I really appreciate everything you're doing. And I'm really excited that Hunt Vitality and the Nest are joining forces.
Oh, it just feels right.
It's right. And we need it. We need it in this community. It's very important. So I look forward to expanding even more.
Well, awesome. Well, thank you so much. I'm going to go ahead and end this recording and I'll talk to you soon.
All right. Take care.
Bye.
Bye-bye.